Knock and hygiene. Hello, how are you today?
Good, how are you?
Good, thank you. So my name's Ashley. I'm going to be your nurse today, and I'm going to be doing a head-to-toe assessment. Is that okay?
Yep.
All right, so can you state your full name and date of birth for me?
Joanna Lewis, 10/9/93.
Okay, and do you know where you are?
Northeastern.
And why are you here?
Here for a checkup.
Okay, and do you know who the president is?
Donald Trump.
Okay, perfect. So I can say that the patient is alert and oriented ×4, speech and articulation as well, and also upon entering, I'm just doing a general survey, noting that she's not in any distress, doesn't look like you're in any pain. Are you in any pain at all?
Nope.
No? Okay. I'm noting proper hygiene, posture. I don't see any outright abnormalities upon first impression. So I'm going to move to the head assessment. So first I'm just doing an inspection. I'm looking at the full head. It's symmetrical. It's proportional to her body. Everything is midline. Nose is midline. Color is good, pink, and I don't see any ptosis of her eyes, drooping, strabismus or lazy eye. So I'm going to move on to her scalp. So I'm just really looking at her hair, looking for any bald or dry spots, wounds, lesions. And none of that, so that all looks good. I'm then going to palpate your ears, so I'm kind of looking, seeing if there's any redness or drainage. Does any of this hurt at all?
Nope.
No? Okay, same here. No pain?
Nope.
All right, good, so looks normal. Next, I'm going to palpate your lymph nodes. So while I do this, just tell me if there's any pain or tenderness at all. Okay, so I'm looking here at the occipital, post-auricular, pre-auricular, the parotid, the retropharyngeal, submandibular, submental, the anterior cervical, posterior cervical, and supraclavicular. And any pain or tenderness? Nope, and I didn't notice any lumps or masses, which is a normal finding. So now I'm going to move on to your eyes. So just looking. Everything looks normal, no lazy eye like I said before, drooping, sclera is white, and everything looks good. I don't see any redness. So I'm going to test some of your cranial nerves and eye muscles. So what I'm going to have you do is look straight at my nose, and I'm going to shine this light in between your eyes. Try not to look at the light, okay? Okay, good, and the light reflects back to me equal and symmetrical in both eyes. So now what I'm going to have you do is follow this pen. Try not to move your head, just follow it with your eyes, okay? Good. So I don't note any nystagmus in that. Next I'm going to test your pupils. So again, just look at my nose. I'm just going to shine a light in each of your eyes, okay? Good, and that looks normal. Pupils are equal, round, and reactive to light, and they accommodate from about a 3 to a 2, which is a normal finding. So next I'm just going to look at your mouth, so if you can open and say ah. Good, I don't note the tonsils are swollen at all, the tongue looks pink and moist, lips are non-cracked, and everything looks good there. So I'm going to move along. So I'm going to have you shrug your shoulders. Good, that's normal, good strength. Can you feel me on both sides?
Mm-hmm.
Good, and can you squeeze my hands? Good, normal strength. And the whole while I'm kind of just inspecting her arms. I don't note any wounds, bruises, lesions. Skin looks intact. I'm going to check for capillary refill, which is less than 2 seconds, which is normal. I don't note any clubbing, which is good. And I'm just going to check for your radial pulses. Good, they're equal, strong, and bilateral, which is good finding. So you can relax down. So next I'm going to move on to my cardiac assessment. So I'm going to be listening to your heart sounds. You don't have to do anything at all. So here, I'm going to start with my diaphragm. I'm going to listen to where I can hear the aortic valve the best, which is the second intercostal space, right sternal border. Sounds normal. And the second intercostal space, left sternal border, is the pulmonic. Good, and in both of those spots I hear that S2 is louder than S1. We move down to the third intercostal space, which is Erb's point, and I hear that S2 and S1 are equal. And I'm going to move down here to the fourth intercostal space on the left sternal border. where S1 is louder than S2 in the fifth intercostal space, mid-clavicular line, the mitral valve, and I hear that S1 is also equal or is louder than S2. So I'm going to switch to my bell, and I'm going to listen to all of those same landmarks. And now I'm listening for a murmur. So lean forward just a little. Good. Good. And I don't hear anything there, so that's normal. I'm now going to auscultate your apical pulse at the fifth intercostal space, mid-clavicular line, and I'm going to palpate your carotid and see if there's a pulse deficit, which there is not. They are equal and symmetrical, so that's a good finding. I'm also going to palpate. Good, and that's normal. No lifts or thrills that I can feel there. So now I'm going to palpate your carotids. Good, and they are strong, equal, and bilateral. And I'm just going to listen to hear if I can hear any bruits. So what I want you to do is just take a big deep breath in and hold it, okay? Deep breath in, hold, and relax, and deep breath in. Good, and I don't hear anything there, which is a normal finding as well. So next I'm going to move on to my respiratory. So I am, again, inspecting like I did before. I don't note her using any accessory muscles, retractions. Do you have any difficulties breathing? No? Okay, good. So I'm going to listen to hear if I have any adventitious breath sounds. So I'm going to start here. Good, big deep breath in and out. Good, and everything looks good. I'm going to have you turn around. And same thing here, listening to your lungs again, so big deep breaths in and out. Good, and here I hear the bronchial sounds kind of up towards the neck, which is, I hear expiration is louder than inspiration, which is normal. And here I'm hearing the bronchial vesicular sounds, which inspiration and expiration is equal. And at the base, I'm hearing the vesicular sounds, which is inspiration is louder than expiration, which is a normal finding. So everything sounds good. I don't hear any adventitious breath sounds, wheezing, stridor, or anything like that. So I'm just going to test for respiratory expansion. Big deep breath in and relax. Good, and those my hands move equal, they're symmetrical, and that's good. I'm going to test for CVA tenderness while I'm here. So I'm just going to tap your back. Let me know if you have any pain, okay? Anything there?
Nope.
Anything there?
Nope.
Okay, great. So I'm going to have you turn back. And what I'm going to have you do now is lie flat. Okay, so now I'm going to start my abdominal assessment. So first I'm looking at her abdomen for any distension, any masses, any abnormalities at all, which I do not note upon inspection. So next I'm going to auscultate her bowel sounds. So what I'm looking to hear is 5 to 30 sounds in each quadrant, and I'm going to listen for up to 5 minutes each quadrant if I do not hear anything. Good, so bowel sounds are normal and active. Now I'm going to switch to my bell, and I'm going to listen to the abdominal arteries. So I'm going to start the aortic. Good, move to the renal, iliac, and I could do the femorals as well, and I don't hear anything, which is a normal finding. So next I'm going to move to palpation. I'm going to touch your stomach. My hands are cold, I apologize. If there's any tenderness, just let me know, okay? Any pain? No? Good? All right, so everything feels normal. I don't feel any masses, anything like that. Are you moving your bowels regularly?
Yep.
And do you have any issues urinating, any pain at all?
Nope.
No? Okay, so everything checks out good there. I'm gonna have you stay like this, and I'm gonna move my hands down your legs. Can you feel me on both sides?
Yep.
Good, and can you press your feet up against my hands and down like a gas pedal? Good, and raise this leg, raise this leg. Good, so good muscle strength. I'm also inspecting the legs for any edema, which I do not see, hair distribution, which seems normal, color, warm, which is normal. I'm looking at the toes. I don't see any abnormalities in the toes or toenails, look healthy. Checking capillary refill, it's less than 2 seconds, it's normal. I'm also gonna check the pedal pulses. So I'm gonna check the posterior tibialis, strong, equal, and bilateral, and the dorsalis pedis, which are equal and bilateral, and they are strong as well. So I'm going to have you sit up and dangle your feet off the edge. And the last thing I'm going to do here is just checking your patellar tendon reflex. Ready? Good. Good. All right, so everything checks out normal. Do you have any questions for me?
Nope.
No? Okay, so that is the head to toe.